Okay, a very good morning to everyone watching in today. Thank you so much for making this your channel this Sunday morning, and thank you so much for tuning in. Today we are privileged to start a new month of November with a very special discussion around fertility. Did you know that 0.8 of men in Uganda are facing primary infertility, and about 3.8% of men actually face secondary infertility? In Uganda alone, close to 35% of all the population of men are the cause of infertility in couples. In other words, 35% of infertility in couples is believed to be due to men-related causes. And unfortunately, majority of the men actually don't believe this. So many times when there are infertilities in couples or families, the blame is always pushed to women. But research shows that close to 35% of all the causes in Uganda are related to male-related issues or causes. 14% of all men in Uganda still cannot conceive naturally. Globally, close to 55 million men cannot conceive naturally. Now, as we have these discussions around fertility, pregnancy, and having children, we have to take it in good faith, and we have to pay attention to friends of ours, friends, the couples, men and women out there that have failed to have children naturally or that have fertility issues. Children are a gift from God. And trust me, every one of us would love to bear the happiness and the joy of having these gifts from God. But what happens when this hope delays? What happens when you cannot have children naturally? What happens when you fail to conceive naturally? To join us for this discussion today, we are joined by a renowned professional expert around the issues of fertility, Mr. Paul Chibenge, a clinical embryologist from Uganda, particularly from Uganda's first fertility clinic that has been around for more than 25 years, formerly called Bukoto Fertility Center, now called Women Hospital Bukoto, with more than 10 branches in the country, and they have been offering the services around fertility for more than 25 years. He's a landman, almost now turning into a lecturer or teaching support staff that want to work around fertility-related services on how to do this job ethically, but also well, because there could be also so many other related issues. Let's welcome Dr. Paul. Yes, Dr. Paul, good morning.
Good morning, viewers and listeners. I'm glad to be here.
We are also glad to have you around. Mr. Paul.
Hello.
Yes. Can you briefly tell us who you are, what you do, and what Women's Hospital in Bukoto actually does?
Okay. Thank you very much and for the kind introduction. My name is Dr. Paul Chibenge, a trained medical doctor. I also trained as
I think Mr. Paul is having some connection issues, but I should join us shortly. So again, we are going to have our discussion around fertility issues, especially in men, because we believe this is an area that has been neglected by so many people. And again, the person we are having is an expert, is well known for this. He has done it for so many years. And so we believe he's going to give us information that can be trusted, information that is reliable. So he's been, I think, disturbed by internet, but he should be back. He should be back to our studio soon. Okay, so yeah, if you're out there, please inform friends, share this with so many people, and tell them to tune in and listen in, because you could never know who could be having these issues, or who could be experiencing these problems. Yes, like I said, in Uganda alone, close to 14% of all the men you see are having infertility issues, and unfortunately, on so many occasions, we always push the blame to the ladies. The causes are many. The causes are many. Like the doctor is going to explain, some are hormones, related to hormones within our bodies. Some are related to what we eat. Some are related to what we do. Some are related to age. Some are related to the nature of job or work that we do. But all in all, there is hope at the end of the day. There is hope at the end of the day. He should be joining us soon to continue this discussion. Just tune in and please inform that friend to join in, inform that friend to listen in to this wonderful discussion. You never know who could be suffering actually from this. From our churches to our family gatherings or meetings, again, you never know who could benefit from this. Everyone would love to have a child. So if you've gotten one, naturally, do not take it for granted that it is that simple for everyone. But also for friends and families that have not been able to have these, just a reminder that all hope is not lost. The alternatives, and we are here to exploit those alternatives. Again, we are going to have in our studio today Mr. Paul Chivenge, who is a clinical embryologist by all the way from Women's Hospital, Bukoto, or formerly known Bukoto Fertility Clinic, Uganda's first clinic to
Hello, are we back together?
Okay.
Yes. I hope you can get me now.
Yes, doctor, we are happy to have you back. Again, my question was, can you tell
Yes.
us again who you are, what you do, and
Yes.
exactly what Women Hospital in Ibukoto does about fertility before we go in for the discussion of the day?
Okay. Yes. Name's Dr. Paul Chibenge. I work with Women Hospital International and Fertility Center as a fertility doctor, and I'm the academic registrar of Salis International School of Fertility Medicine. The first one in East Africa, which is going to train health workers into this new field of fertility. Yes, we are aware that there are many growing number of facilities that are doing fertility medicine, but the catchphrase is that many of the people who are doing this work are not trained professionally to do fertility medicine. Yes, so that is why this school has been started. We are in an advanced stage of setting up the school. I trained as a pharmacy technician, medical doctor, health service manager, and now I'm a clinical embryologist. Thank you very much.
Doctor, let's start there. So, what does a clinical embryologist do?
Embryo- Yes.
What does a clinical embryologist do in this fertility setting?
Yes. Embryology per se, it is that time when an embryo is formed that develops into the babies that are produced. So, as a clinical embryologist, you are trained to know knowledge right from the time the fertilization takes place. Yeah, you know how the garments are brought up. They come into existence. The garments I'm talking about the sperm and the egg. So until these two unite in the fertilization process, we will not have, we will not be where we are. We will not be humans. Okay? Yeah. After fertilization, that is the time you are going to have a zygote formed. Yeah? And then immediate after the zygote, the embryo takes place. The embryology takes growing. 1, 2, 3, 4, 5 days until it gets implanted into the uterus, and then we keep on waiting for the baby. So my area of specialty is around this process because we found it's the most important area of fertilization. Yeah, just to be very specific, it is different from gynecology, because many people, whenever I tell them that I'm an embryologist, they say, oh, no, so you are a gyne. No, it is not gynecology. Even gynecologists come and we have them trained into fertilization. Thank you.
Okay, doctor, our topic of the day is when hope delays. Like I said, every family would
Yes.
love to have children naturally. But statistics are showing us that the number of men that are responsible for infertility in couples is rising, especially in Uganda, where they are saying that close to 35% of all infertility causes or issues in couples now is based on the men or is centered around the men. Let's have a discussion, doctor. Why is this discussion of infertility in men important today?
Yes. Okay. Yes. Thank you very much. I believe that many people here are Africans or come from African culture,
Yes.
where we know that when people get married, man and woman in this case, you expect to have children. You know, I know when I talk about this, people in the Western world will say, no, there's a couple I know who is my neighbor and they have a marriage contract that have no bearing of children. Yeah. But in Africa, that is the expectation, or in the culture of the black race, if you could say that, people are expected to have children. Unfortunately, down this road, you find that the child doesn't come, 1 year down the road, 2 years, three, and even more, you know, a person fails to conceive. That is the woman. Huh? I'm saying she fails to conceive, but you are forgetting that she can also not conceive alone. There is a man that can make her conceive. So that is the picture we always forget when we talk about infertility. We have been for long pointing a finger to women. Say, yeah, in my local vernacular, we say, omukyala aganye okuzala. The woman has refused to conceive. Yet they don't point a finger and say, omwami alemereddwa okumuwa olubuto. Or the man has failed to make her conceive. So that part is not discussed. So that's where we are this morning, and we look at reasons why do men fail to make their wives pregnant. Okay, to start with, infertility is a condition, like we said, the woman fails to conceive, but a man also fails to make her pregnant after 1 year without using protection. Eh? Because you forget about the people who are using family planning per se. Yeah,
Yeah.
there has to be
So,
an existence or a duration of 1 year, and there has to be no protection. Yes.
so, doctor, you want to tell us that
Yes, sir.
if I've met my
Mm,
girl for 6 months
mm,
and we've had intercourse, maybe say, yeah, we meet
mm.
once a month, and yeah, for 6 months we fail to get
Yes.
pregnant. We don't qualify to say that there are infertility issues.
Mm. Pregnancy. No.
So it must be a
No.
period of
That is
1 year.
what we call delayed fertility. Yes.
So, doctor,
Of
let us
one
start
year.
there.
Yes. That is by WHO standards, by one
So,
organization.
so what
Mm.
is the difference between delayed fertility and infertility?
Mm. Yeah, delayed fertility, like you have said, it does not make 1 year. And sometimes it can even be delayed for couples that are fertile. Yeah, but for different reasons. Yeah, you might be a long distance truck driver. You are driving from Michigan to Kansas to Chicago, and
Mm,
the time you come home,
mm,
probably that is a time that your girlfriend is not during the ovulation stage, okay,
mm,
where she
mm,
can conceive. Yeah,
mm.
then when you arrive, you stay for 3 weeks, you go back,
Yes.
or 2 weeks, yeah, without targeting that window of fertility. So that
Okay.
can be called as delayed. Yes,
Mm,
yeah, but it's not necessarily infertility. But I'm talking about people who are living together
mm,
for a year and not using any form of family planning,
mm.
and even their desire is to have a child and they fail to conceive. That is what we are terming as infertility. Yes.
Okay. Doctor, as an expert,
Mm,
how common is
mm,
this infertility issue
mm.
in men? Yes, I've read the statistics here, but
Well,
mm,
mm,
according to
mm.
your experience, how common is this problem in men?
Yes. In Uganda, first start as couples. Yes, 1 in 6 couples in Uganda are struggling with infertility. That is the latest statistic we have. But you gave a percentage of 35% of the causes coming from men, and 35% will definitely come from women. Okay,
Okay.
that
Yeah.
makes it 70.
Yeah.
Then give it 15% coming from both, uh,
Okay.
both men
Okay.
and women. Okay, and I'll save the last 15 into unknown. Okay, because we also have what they call unknown infertility, whereby at the end of the day, everything will be tested, everything will be tried, but still no conception occurs. So that's where we are. But we believe as scientists that by the time someone gets 85% of the causes, you definitely know what the cause of the infertility is. Yes.
Okay, doctor. Let us hit the nail on the head.
Yes.
What are the major
On the
causes
head.
of
Let's go.
infertility in men from your clinical standpoint?
Mm. In men.
Yes.
Yes. Men specifically, uh, we are having a problem of alcohol consumption. That is one. Okay. Alcohol can reduce your ability to have good viable sperms. Okay. It can reduce your functionality. You know, if you are really excessively drunk at that time of the copulation, definitely you're not going to be able to sleep well with your spouse or with your wife, whatever it is. So it is a very big factor. But above all, age is a factor in both men and women. Mm. In women, you give it between 30 and 40 years in women. That's your fertility window. So give it 35. At 35 years, a woman has a 50% chance of conceiving. Okay? I'm not saying that above 40, a woman cannot conceive. We can also look at that. But we give them between 30 and 40 years. In men, closer to 50 and above. And our problems are coming from both the sperms that are produced and also the erection power, okay, that a man will have. Yeah. If you have watched yourself grow up very well, the number of erections you used to have when you are a teenager, at puberty stage, could not be the same as when you turn 30 and when you turn 40. So when the ages go up, that one also becomes a problem. Then you have sexually transmitted diseases. Okay, these ones will go down and affect the anatomical structures of the male reproductive system. Yeah, it's example of infection from microorganisms like chlamydia and gonorrhea. You know, they will totally mess you up. Yeah, you could be suffering internally, but when you don't know what is happening. Okay, use of tobacco products and drugs, you know, stress is one of such a reason that people will really become infertile. Environmental toxins, you saw in Uganda, people were living in Kitezi, others were being chased from Lubiji, but these are dumping grounds, okay, of toxic materials. Mm. Yeah, people who work in factories, okay, and who prepare chemicals and pesticides and lead, all those have an effect on fertility. And then when you talk about the Western diet and lifestyle, we will talk about obesity, being overweight. You know? Definitely starts by affecting your performance. Okay. Then you have, yes, the gametes are produced as a response to hormones that are produced we have what we call hypothalamo pituitary axis, okay, that produces enables our bodies to produce the hormones. Right from the hypothalamus, there's gonadotropin releasing hormone, which acts on the anterior pituitary gland, and which releases follicle stimulating hormone and luteinizing hormone that works on the gonads. Okay, that is going to work on the ovaries, and that is going to work on the testicles.
Oh, okay. Uh, Again, forgive us. We are for that network connection. We shall make sure we get the doctor back. But again, thank you so much for watching up to this point. And remember to subscribe, to comment, and to share this video. We are really happy to have this expert, like you can hear, is talking from a place of knowledge. We are so unfortunate that network keeps jamming him up and down, but we believe we shall be able to have this show completed. Again, if you have any questions, start putting them in the comments section, such that the expert is able to respond to them. Again, thank you so much for keeping yourself here and for joining in this morning. Forgive us about the connectivity, but we shall have the expert back. Put your questions in the comment section. So many of you have been asking me to have a discussion around this, a discussion around fertility. So many people are experiencing fertility problems as couples. And like the doctor said, most of the time the fingers have been pointed to the ladies. But today research is showing that actually 35% of the causes of infertility in all couples is due to men, and the other 35 is actually due to women, and 15% is due to both when both of you have a problem, and the 15% is not known.
I'm sorry. I'm really sorry. We're getting interruptions in the network.
Can you help me and
But
turn your phone around? Doctor, can
yeah,
you turn the phone around like we did last time?
yeah, I've done, but just taking time to picture.
Okay.
Yeah,
Okay.
just turned finally.
So, doctor, you were still explaining the other causes of infertility, and you were at the point of diet
Yeah.
and obesity.
Diet and obesity, which is very important in the Western world because of obvious reasons. Then I told you about the hormonal causes of
Yes.
infertility. Anything that affects that hypothalamo pituitary axis can also cause infertility.
Yeah.
Yes, like thyroid disease, tumors that can affect the axis will also affect fertility. Then chronic disease conditions, diabetes mellitus, hypertension, cystic fibrosis, okay? All those are reasons that men can become infertile. We also have what we call varicose seals. Those are enlarged veins, okay? They will also cause infertility. Then chromosomal disorders, okay? Now, here is where I want everyone to listen very well. They are what we call heat radiation that you are going to affect your testicles. I know we are going into steam bath and hot tubs and saunas We are wearing tight clothing.
Mm.
We are carrying what we see as laptops. Okay.
Mm.
Okay.
Yes.
Anything that is going to cause heat around your
Mm.
testicles can
Mm.
cause infertility. Yes. You find the sperms were there originally, but
Mm.
finally you have killed them because when we were created, these tests are supposed to be hanging outside our body. Okay.
Mm.
That's why you realize that sometimes when it is cold, they become
Mm.
they
They call it up.
extend out, and when it
Yeah.
is hot, okay, yeah, they coil up. Okay.
Mm.
Yeah, or either way.
Mm.
So God was very smart when He was creating us. Our bodies are at a temperature of about 37 degrees, and these
Mm.
tests are supposed to live in a temperature of 35 outside the
Mm.
body. So anything that can affect them in terms of temperature can cause
Mm.
infertility in men. Then the scrotum, or if you have trauma, you are in Kampala, you're riding on border borders, you have an accident,
Mm.
God forbid, something affects your testicles, that one can cause you to be fertile. Low hormone level
Okay. I think network is jamming, but yes, please. Low hormone. Yes, doctor. You were talking about low hormone. Okay. I think we have lost. Yes, doctor. I've lost your volume. I've lost your volume. Okay. I've doctor, I can't hear you. Have lost your volume. Hello, can you hear me? Okay. Doctor, can you hear me? Doctor, can you hear me? I doctor, can you unmute? I think you've muted your phone that side. Can you unmute? Oh. I think it's muted. Okay. Again, we are experiencing connectivity, but he should be back. It's a very interesting conversation. It's a very interesting conversation, but we are being disturbed by connectivity, but we should be back to finish this discussion that we feel is very timely and very interactive. Again, if you have questions, please leave them in the comment section, and we should be able to have this discussion with this Dr. Paul Chibenge from Women in International Women's Hospital in Bukoto. We're having internet issues, but that should be sorted. Yes, like I said, and like he has emphasized, the causes of infertility in men are so many. He has talked about alcohol. He has talked about these STDs, those are sexually transmitted diseases. He has talked about stress. He has talked about tobacco and smoking. He has talked about environmental toxins. Those are pesticides and insecticides that we use while we are working in our farms. He has talked about diet and especially obesity in men. Men who don't want to work out, men who just consume sugars, foods rich in sugars. And so he has talked about those. He has talked about hormonal causes. This is when your hormones as a man are affected, and here the causes are so many. Sometimes they are caused by diseases to the organs that produce these hormones, like the thyroid. He has talked about chronic diseases. Some of these diseases that affect the genitalia or the factory where these sperms are made. Remember, a man is born with their sperms. So some of these diseases actually target and affect the factory. No, remember where your sperms are produced. So sometimes some of these diseases actually target the factory where the sperms are made, and they also affect the fertility of men. He has also emphasized the issue of chromosomal disorders, especially caused by excessive heat. Now, when we are talking about excessive heat, men who go to saunas and hot bathtubs, the scrotum that keeps our eggs normally rotates outside the body, and there is a reason why God put it outside the body. And the reason is simple, because our testes need to operate in an environment that has reduced or lower temperatures. That's why they are hanging out. And even when the temperatures go outside, God has given them a mechanism to either coil up or react in a certain way. But now when you go to for these hot tubs or saunas, every now and then, you're literally affecting the factories that are supposed to produce your sperms. And this could be one reason as to why you're not able to produce viable sperms. So that is something that all of us must look out for. And again, we apologize for the internet issues, but we promise we shall make sure we finish up this discussion. We shall finish up this discussion. So there are so many causes. The doctor also explained, yes, doctor, we are glad to have you back. We are glad to have you back.
Entirely sorry. Yeah. Yes. I'm sorry for the misses we have had. But I'm promising you, I'm broadcasting this from home. So next week, I'm going to be next weekend or next show. I'm going to be in the mighty city of Mbarara. So I'm hoping that when I'm in a city center in a hotel, it will be very easy, and you'll get a better broadcast than this one today.
Okay, yes. Doctor, can you put your phone straight?
Yes, straight or
because it is not turning. So okay, that is okay. So yes. Doctor, let yes. us proceed. You were emphasizing the point of steam, sauna, and the hot tubs, and actually I wanted you to throw more emphasis, because today men find saunas and hot tubs as a fancy thing. Can you throw more light on that?
Mm. Yes, I told you that when we are being created,
Yes.
our bodies, the
Mm.
testicles, are supposed to be hanging outside the body.
Mm.
Mainly, they work on what you may think as a thermostat. You
Mm.
know, you have all used flat irons. Okay,
Yes. Yes.
when the iron is too hot, it switches
Yes.
itself off. Okay,
Mm.
and when it gets cold, it heats up again. Yeah?
Yes.
So in the
Yes.
same way, uh, these what testes,
Mm.
okay, they are located outside the body.
Mm. Mm.
Yes, to regulate their location based on the temperature of the body.
Yes.
To start with, the body is at 37 degrees. Okay,
Mm.
I'm talking about in terms of centigrade in Uganda. Okay,
Yes.
I don't know what
Yes.
that is in Fahrenheit in the United States. Yes, so
Okay. Again, um, okay. Doctor, can you adjust your phone? No, 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 no. You turn. Can you turn your phone back? It. Jeez. Okay, doctor, can you turn your phones? Oh God. Okay, uh, we apologize for the connectivity issues. Uh, we are really working hard to make sure we restore connectivity. We are working hard to restore connectivity. Um, we apologize. We should be able to restore connectivity in a shortest period of time. Let us have a break and we should be back. we apologize for the hiccups in connectivity, but we shall make sure we make it up to you, and we shall make sure that we finish up this show. Again, like Doctor was emphasizing, men, sauna, and hot bath or hot steam affects the place where these eggs or these sperms are made. So we need to regulate how many times, how far we go actually for this hot bath or steam and sauna. In Kampala, we normally find a group of men, or especially those that have some money, taking sauna as a relaxation activity almost every day. But this is very dangerous, and it could be associated with the high rising number of men that cannot have children naturally, because it affects the quality of sperms that you produce. Remember, fertility starts with the quality of the eggs and also the quality of the sperm that are being produced. Remember, fertilization is the union of the male gametes and the female gametes to form that zygote. Now, without quality sperms, most of the times you're not going to have quality or positive outcomes. And like we said earlier, so some of the causes actually to infertility can be solved, or can be we can have a solution to them. But those that normally affect the place where these sperms are made, most of the times are hard to solve, because they affect, it's like they affect the factory where these sperms are being produced. Again, we are trying to connect back with Dr. Paul to make sure we complete this important discussion, and God willing, he should be able to have this to join us later. But again, if he fails, he had promised to wish we could also have a repeat of this program in the middle of the week. So that is how sometimes we experience these infertilities, and any causes that have to do with the sperm itself are normally hard to solve. For example, if you cannot produce mature sperms, if you cannot produce maybe viable sperms, because sometimes you can produce mature sperms, you can produce sperms, but the sperms are not viable. You can produce sperms, but they don't have a tail. You can produce sperms, but the amount is not enough to for you to cause natural fertilization. So at least those that are able to produce sperms in low quantities, that's where some clinical fertility procedures come in to assist. But if you're doing things that are affecting the quality of sperm that you're producing, in other words, you're producing sperms that are not viable or stale sperms, then sometimes even the solutions become complicated. So as men, we've really got to watch out on what we do. We've really got to watch out on these hot tubs or saunas to make sure we don't expose our testicles to high temperatures that eventually affect the quality of sperms being produced. So as men, yeah, we've really got to watch out on what we do. We've really got to watch out on these hot tubs or saunas to make sure we don't expose our testicles to high temperatures that eventually affect the quality of sperm being produced. Yes, yes, doctor. So as men, yeah, we've really got to watch out on what we've really got to watch out on. We are trying to make sure to connect to Dr. Paul to make sure we finish this discussion. Again, we apologize for this internet connectivity, but we promise we are going to make it up to you. We are going to finish this discussion. Yes, Dr. Paul, are you able to get me now? Okay. Yep.
Yes.
Yes, very, very clear.
Yes. I did not also talk about people, our underwears, the boxers that we are using, and bikers. Okay.
Yes, doctor, can you put
Their
your phone a
quality
little
is
bit?
also an important.
Can you adjust your phone? Can you put a little bit away from your face?
Yes.
Okay.
Yes.
That is okay. Yes, proceed.
So I was telling you that even the quality of our underwears that we wear are also a factor in that heat catalog. Okay.
Yes.
Yes. We use bikers, which are very tight on our bodies. Okay. And also nylon underwears. They are also trap a lot of heat on the body, and that will also kill the sperms eventually. Okay. Then I spoke about laptops. Okay. The laptops we are using will generate heat. If you put that, the way it is called a laptop, you put it on the lap, you'll feel heat when you are using it. Okay. So that one can also affect our sperms per se. Okay. Then surgery. People who have had vasectomy, of course, that is permanent sterility in men. They will not be able to produce. Then the biggest problem, especially as we advance in age, is erectile dysfunction. Okay. Because you know that it's after erection that the sperms are able to be deposited inside the vagina canal before they can move all the way up to where the egg is. Okay. So it is more like you have been seeing the war between Israel and maybe Iran or whichever country it has been fighting, Palestine or Hamas. They launch missiles, but the missiles have a propelling power that launches them. Okay, that propels them. Okay, so if you are not able to launch the sperms to be able to enter through the vagina canal, through the cervix, through the uterus, through the fallopian tubes, up to where the eggs are, the mature eggs, which you are during ovulation, then you are not able to produce. That is common sense. Okay. So that is also, those are all reasons that can cause infertility in men. Okay. Yes, then steroids. The use of steroids can also affect your sperms grossly. Yes. I believe we are still together now.
Doctor, there is, I think, a device around you that is having the same program. Please reduce its volume. It is bringing echoes.
The same program.
Yeah.
Okay.
Okay.
That
Now
was
you're
the
very
laptop I'd put on your table. Yeah.
okay.
I'm very clear, but now the picture is not coming.
Okay.
But anyway.
It is okay. Now you're okay.
Are we together now? Yes.
Yes. Very okay. No, doctor, at you've talked about a lot of things, but while the internet was disturbing you, there is a point that I wanted you to stress. That is sauna and steam bath in men in Kampala, especially those that have gotten some money. almost every evening, a group of rich people always go to some saunas and they keep burning their testicles. I call it burning your testicles. Doctor, I want you to re-echo the emphasis on steam bath and its cause to as a cause of infertility in men. Oh, Jesus.
So if you are going to increase their temperature in the scrotum, they definitely die.
Yes.
You'll find that people come to do lab tests, and you find what we call necrosospermia, necro meaning dead body, necrotic. Yeah. You find necrosospermic men coming simply because they have denatured the environment where these sperms live in the testicles. Yeah, I say heat from sauna, from steam bath, from laptop, from very tight underwears, okay, from bikers, you know, people who wear bikers when they are going to do biking, okay.
Yes.
All those things affect the temperature of the scrotum, and they can cause sperms to die, okay. So it is very, very important that you don't, yeah, I know people are encouraged now that you go and lose fat and you go and lose weight by using those methods, but I can tell you from a reproductive perspective, they are killing their own sperms. Yes.
Doctor, let's talk about
Yes, sir.
At what point should a couple consider medical evaluation if they are struggling to conceive? At what point?
Yeah. From the point of the definition, I told you, if you have been together and you are not family planning for a year, yeah, you should start going to seek help. There are many tests, or there are more tests that women do than men. For a man, what you are going to do, the first basic test for fertility is sperm analysis, okay, or semen analysis, okay. There are also people that don't produce sperms at all, okay. You might have semen that comes. I think your viewers or listeners can differentiate the difference, that there's a difference between the semen we see with our eyes and the sperms that the microscope sees, okay.
Yes.
So you might have semen flowing but does not have sperms, okay. And that can be totally a dry semen, that what we call azoospermic, okay, that has no single living sperm in it. Or it can have few sperms, which we call oligozoospermic, okay. That one is also there. You can have sperms that cannot move, with poor motility, which we call astenosospermic, okay. We can have sperms that have poor morphology, okay,
Yes.
which they are poorly shaped, yes, which we call teratosospermic, okay. So the biggest cause of infertility in men in scientific description is a combination of the three parameters. That is the low sperm count, the poor motility, and then the poor morphology, which is a long word called oligoastenosouregulators.
Wow.
So that is the biggest cause of infertility in men in terms of investigation. Yes.
So
Yes, sir.
to men listening in right now, I know the issue around sperms is a big discussion, and because we've been discussed with internet, I'm going to have a recorded version with Doctor that I'm going to play with you on Thursday morning, we are going to have a discussion just about sperms. He's going to take us through low sperm count. Immediately after here, we are going to record it. And so on Thursday morning, you're going to find this discussion. So, doctor, is infertility in men always permanent, or some cases can be treated?
There are cases that are reversible and there are cases that are irreversible. And where they are irreversible, it is very painful to say, but we always because of the interruptions we had a lot to discuss. But where we find that a man's infertility cannot be treated, that is after we have tried to do a semen analysis, we got no sperm, we do what we call a testicular sperm extraction, which is briefly known as TESE, where we cut like a centimeter on your testicle. And then we go right deep into what we call the seminiferous tubules, and we pull them out because that's where the source of the sperms come from. We put them in the microscope and we find if there are sperms there. If a person had what we call OA, obstructive azoospermia, that may be, it is just the ducts where the sperms move from that are blocked, but the sperms are there. So there we can help a person to recover some sperms from the source, from the seminiferous tubules. But if we find that even there, where they are produced, they are not there, we advise the patient to do what? To be able to get donor sperms, okay? To make sure that is if the wife, okay, the spouse has no issues, to make sure that they can have a child. Because the bigger thing is to have a child. And once this child is born, it is yours. It will never know any other father. It is just in your mind that this child is mine, but it doesn't have my DNA. Yeah, but donor sperms are available. Donor eggs are available. So that is in an irreversible situation. But in terms of improving the count, improving the motility, those ones have treatment. We always give people treatment, and then that can be reversed, sir.
Before I leave that point of donor eggs, I've so many times been I've been so many times contacted by friends of mine who want to donate eggs. Is this like a blood donation where people just come and give out free eggs, or people pay to donate these sperms? How do you get these sperms, doctor?
Sperms are donated, but you may not get as much as a sperm donor than an egg donor. Eggs, sperms are produced in millions.
Okay. We are being disturbed by internet, but again, I promise that I'm going to make sure I have another recording immediately after here with doctor to make sure we handle all the issues that we could have missed out in this episode because of the internet. But it is a very interesting discussion. For some reason, the devil has really fought this program, but we thank God for the far we've come. I believe this is a discussion that we are supposed to have as men, and this is a discussion actually that we are supposed to have. Again, thank you so much for being patient with me. I know it's been frustrating, but even from the studio side, we've tried everything that we can. Thank you so much for being here with us. We shall try to go as far as we can push it. But I'm going to have another recording to discuss sperms and all those other issues that we could have missed out in this episode today. We've really tried to push it. We've really tried to work around things, but the connectivity of internet still remains a challenge. So I'll again try to see if we can have Dr. come again, but if we can't, we are going to proceed. It is very interesting. It is very interesting to have this discussion because so many men are living in hiding behind. Men don't want to come out and accept that actually we are responsible for some of the infertility issues. But we are here to talk about those discussions, uncomfortable discussions that so many societies do not want to confront. Because like I said, of all the couples that can't conceive now, 35% is due to men, 35% is due to women, 15% is due to both of you having causes, and 15% the causes are not known. That means there are couples that will actually check for everything, but then they are not able to have a child. When everything is normal, but they are not able to have a child. I think that 15% belongs to God. Yeah, but we are going to really try to make sure we have this discussion again in one of our coming. And again on Sunday, we shall make sure we have better connection when we are going to be continuing with the same discussion. With the same discussion. Let me see if we can have the doctor back, and if we can't, we shall close this one and then upload another one. Thank you so much. If you're here and you've not subscribed, please subscribe. And remember to share this recording with someone. There is a couple that you don't know that is silently fighting the battle of infertility. And we can only be helpful if we share these videos in groups with people, because most of the time, people that are having infertility will not come out to discuss. You will assume they are practicing family planning, but the reality is they are trying and things are not firing. But important, doctor has mentioned something very crucial here. Men, do you know that you could be ejaculating oba abasinga kyemuyita okumala, and you're releasing some fluids, oba oyina amazzi agakuvaamu, but there is no single sperm in that fluid, which we call firing blanks. Did you know that? That so some of you men, you go in the sexual activity with your ladies, stuff comes out of you, but there are no sperms in that fluid that you released. Now, this is where the biggest confusion comes in. You tell your woman, oh, I'm able to produce semen, I'm able to produce stuff. But when they go under the microscope in the laboratories, there is no single sperm in the semen that you're producing. Okay? There is no single sperm. So, when you're having infertility issues as a couple, it is really very important that we both seek medical advice. Otherwise, so many of the families that have delayed to have children, the cause actually not due to the man. Normally, these women will go to hospital, seek medication, but as men, we continue pointing fingers to these women, thinking they are the ones with the problem, because when you're having sexual intercourse, you come and you see some white liquid come out of your private part. But reality is, when you go under microscope, you're firing blanks. Emundu okuba naye temuvaamu masasi. So before you point fingers, before you want to blame anyone, please. Okay. Yes, doctor.
I can
I'm
even just laugh. Yeah, I'm so sorry. Uh,
I'm glad to have you back, and thank you so much for
mm,
your patience. This is a very important discussion.
yes,
Doctor, uh,
yes.
take me through,
Mm,
if a couple is having
mm,
fertility issues, how do we normally approach
mm,
these men to the point of finding out their diagnosis? What do we do? What do we do at the fertility clinic?
mm. Okay. Before any intervention is done, we have to do investigations. Okay.
Mm, yes.
I'll be lying to you that if you came to a clinic and I just gave you medicine and say, okay, you go and produce without knowing what the source of the infertility is, uh, it will not be helpful to you. And you definitely come to me after 6 months, after 1 year, and say, yes, what you gave me did not work. But we do investigations, especially from the lady. You are going to check her hormones, okay, to make sure that they are okay. Okay. Uh, this we do on the second or the third day of her menstrual period. Okay. During her menstrual period, when she's menstruating, we take her hormonal levels. Then from there, we also check your uterus. Okay. Uterus can have fibroids, uterus can have adhesions, especially women who have had serial miscarriages or abortions. What you say that someone has lost pregnancy and then they take them for cleansing, that one causes scars in the uterus, which are, it's more like a spider web of tissue that develops inside the uterus. And once the uterus is occupied, it's like someone having a structure in your plot of land. It cannot be used. Okay. So they have what they call polyps inside the uterus. They will not also allow the baby to implant. Okay. And then we also check the fallopian tubes. Okay. If they are patent, eh? If they can allow the sperm and the egg to meet. If a road is blocked by traffic, definitely you will not be able to reach where you're going. So we have to make sure that the tubes are also investigated. Okay. Tubal blockage causes almost 60% of the infertility in women. Okay. We check her eggs if they are there, because at some point they cease being available. Yes. So if we do a scan, we can see. Okay. There's a hormone we can do to check ovarian reserve, which is anti-Mullerian hormone, but a scan to me shows better results than checking hormones for eggs. Then with the men, since we are dealing with men infertility today, we check the sperms. Then from there, that's when we decide the type of treatment we give. Yes.
Doctor, let us throw some more light on the
Yes.
men. How do you collect these sperms? Because that's what is
Mm,
causing a scare among so many
mm,
men. I
mm,
remember when I was in Mulago, some men would come
mm,
to me, and each time you refer them to the lab to collect their sperms, they
mm,
always had a mixture of feelings of
mm,
what exactly. How do you collect off the sperm?
mm. The recommended method of collection from World Health Organization is by masturbation. You know, you can have personal feelings about it. You can have your today is a Sunday. You can have your spiritual feelings about it, but that is what we encourage men to give us the best quality of sperms. Because if we tell you to have coitus with your spouse, chances are high that during that excitement of orgasm, there is a chance that you might lose them while you are collecting them, or they can come contaminated with fluid from what, from your partner. So we always get a good clean sample of sperm by masturbation, and that is the method that is commonly used. Yes, apart from what I told you, that a person who has obstructive vesselspermia, we must have to go there and cut the testicle and pick the sperms from there. Yes.
Wow. Again, I've seen places. That's why actually today on my program, I always bring the experts. There is a patient that I saw walking with a bottle of sperms all the way from Nansana, who was taking them to a certain clinic, not even a fertility clinic, but a certain clinic that doctor gave me this to go have the sperm in the morning and bring it to the clinic. Doctor, is that acceptable medically for me to go have the sperms at home and then bring them to the clinic?
Chances are high that those sperms will be contaminated, and they are supposed to be tested within 30 minutes after collection.
Wow. Wow.
That sample was not at body temperature. Yeah, we always tell people who can get accommodation very close to the facility that when you are carrying the sample, you put it under your armpits such that it's at the temperature of your body. It's not about picking it and then you put it in the dashboard of the car, and then by the time you want to get it from the dashboard, you feel that it is not going to be easy for someone to see you with it. By the time you reach the clinic or the lab with that sample, it would have liquefied most of the times. So it is not going to be useful. Yeah, and the sperms would have started. Of course, they get tired before they die. So you might end up with a sample whose motility is poor simply because of the environment it has been moved through. Yeah. So it is not advisable that you can carry a specimen bottle at home, not like urine or stool, and then you bring to the lab. It has to be done at the site or very close to the site, within a distance of less than 10 minutes to walk to the site. Yes.
Doctor, as we plan to wind up this discussion, in African societies, infertility is normally blamed on
Yes.
women. Why do you think male infertility
Yes.
still remains a hidden issue?
Of course, a man is a man in Africa. You talk about African society.
Yes.
So no man wants to be regarded as a woman. Yes. And you are supposed to look like you are in control of things. Actually, you are supposed to be in control of things, including fertility. So now, if a person is going to tell you that you are not able to produce, or that you are infertile for some reason, I think he's making you less of a man. Yes. So that is why we try as much as possible as men to say that I think that is not because of me. Okay. Just like parents will produce a child who has bad behavior, and then the woman will say, no, that is his father's behavior. Or the man will say that is from his mother's side or something. So we always want to claim our position in the family as the tower of the home, and you don't want to be put down. So that's why we always make an escape, even when we are the ones who are causing infertility, to push it to the women. But I've had many times couples come to me and I tell them that, you know what? The problem is it is your man who is trying to what? Who is not producing. But before we do that, definitely I will call the man in secret and I give him the results. I say, you know what? This is where the problem is. It is both ways. Just like HIV results being released. If you decide and you say we are going to receive our results together, I'll put you together and you receive them. But if I find this is a man who first came by himself and tested, the next time he comes for the results, or if he is getting the results, I cannot involve his wife if he was not there, or his spouse. So is the woman, because most of the times that is where when a relationship end up. Yeah, those people you are going to tell together, and you say your wife has a problem, she can't produce. The man will walk the other direction, and they meet at home, and then he starts their way of separation. Or is the woman also? If you tell him your man can't, and this is a woman who has been desperate to have child for long, she will not also be part of the problem of. She will not be enticed to be back in the relationship, and that's why you are having so many children these days being produced outside uh, their relationships, and this DNA things coming up. When a woman has discovered that the man cannot produce, they will go out and have another man and have a child with. Okay, and before you know, you're going to have a child that is not yours. So that is where we are.
Uh, Doctor, I know you've
Mm,
in your practice there are so many myths and false
mm,
information you've encountered about infertility. What are
mm.
some of the myths that
Yes.
you've had from your patients about infertility, especially in male?
In male, we think that a man who is, say, muscular, well built, think about Golola or anyone else you know. Yeah, you
Yeah.
think that that man can produce and has good sperms.
Mm,
That is a myth.
okay.
Okay, you can have someone as giant as Goliath in the Bible, but when
Mm,
they cannot produce,
mm,
that is one. And then two, we think that when a man is old, they can't
mm,
have sperms. They do have
mm.
sperms. The oldest man produced today was 90 years old. Okay,
Wow.
produced by one of our hospitals in Zambia, and
Mm,
he produced a child at 90 years. So, and that is not typical uh,
mm,
for someone to think. So, that one will say, no, that guy is already 70, he can't have a
mm,
child. They will produce sperm, which can fertilize. Yeah.
mm,
In women, we always think that when a woman is getting her menstrual periods,
mm,
she's still fertile. That is also myth. Yes. You can have your menstrual periods up to the age of 50, 55, but when the eggs disappeared long time ago.
mm.
So those are the two myths from both sides. Yes.
Okay, so again, maybe one
Mm,
other myth that I used to find in ultrasound room is men believing because I release olokuba mala, then whichever once I see that
mm,
white liquid, then nze nzaala obuzibu buliko gwe, the problem is with you.
mm,
Not knowing, like you explained earlier, that some of you release
mm.
fluid that has actually zero zero sperm in them on the microscope. So, doctor, let's
Sperms.
talk about stigma.
Exactly.
Let's talk about stigma and emotional
Mm,
support. This journey is not easy, doctor, in our society,
mm,
especially as Black people are facing your family and you tell them, oh, I
mm,
can't, or facing your wife and say, I can't, I really need to go to a fertility center for help or uh, for uh, for for medication. Doctor, how have you managed to navigate the issue of stigma and emotional support during these challenge journeys of fertility in men?
Yeah, fertility can be a very big psychological and mental problem. People run into depression. They are all called all sorts of names in society once they are known. And there's mental problem, right? Even when they start the
Mm,
treatment for fertility, because by that time a person is very expectant. and they think they are going to have that that fails also, it can be troubling because the costs involved in it and the hopes that a person has really will have to disappear, and it's not very easy. And even after, yeah, of course, a person who has tried treatment and they get a child, yeah, the happiness is immense. You know, they'll be overjoyed. But in terms of failure, I've seen a woman fail 3, 4 cycles. Some of them are in polygamous relationships, like women, and they are seeing that their counterparts, their co-wives, are having children. And for her, she has been to the hospital and failed. Yeah. So is men, you know. But men usually, they end up trying. You will see a man marrying one wife, second wife, third wife. They all don't have children, and they all leave and go and produce elsewhere. So it is so stigmatizing when a person is infertile. Yes, that it can even affect the way you perform at work. You see people coming to office, they are not themselves, but they are in their own world of thinking, how do I overcome this? They start hating to attend functions of you having baby showers, you're having deliveries, people going to celebrate with people who have had children, you know, and some of them end up doing things that take their time. I heard about a woman who was doing all kinds of short courses online, you know, to make sure that she's occupied. Yeah, not to deal with the depression. But finally, she ended up producing. So it can really have a very big mental toll on the person who is suffering and on relationships per se. Yes, you meet in the morning, you slept together in bed, you meet in the evening, but when you all have this running around your minds, it is very hard to focus, even to plan for any future together when you have a problem of infertility. So it is very devastating mentally.
Um,
Yes.
this show would really not be important if we talk about the causes and everything, and then we don't discuss the available options. Since I'm
Mm,
speaking to an expert from
okay.
East Africa's biggest fertility
Yes.
center, Doctor, what
Yes.
are some of the modern
Uh,
treatment options available
mm,
for men with infertility today?
mm. Yeah. We start from the simplest, which we call TSI. That is timeless sexual intercourse. If your problem is not having the sperms, but the timing that you have been sleeping with your spouse, that one can be solved. You can be given the cycle, and then you know exactly when your wife is ovulating. They will give you a range of 5 days, 2 days before day 14 and 2 days after day 14, where you can just go in and make sure that he conceives in any of those days. Then, from timeless sexual intercourse, if the tubes of your wife are open, and maybe you have a poor sperm count or so, we do what we call a sperm wash, where we can concentrate those sperms and then they can be able to be put directly into your spouse to make sure that she can conceive. Yes. So that one is also what we call IUI, intrauterine insemination, or artificial insemination. The one you see, artificial fertilization, the one you see done in animals, where they can
Yes.
pick the sperms of a bull and just insert them into the cow. Yeah. So that's another method. Then the third method would be that you have to get the eggs and the sperms, and put them in a dish together. Okay, this is when a baby is produced outside the body, which we commonly call IVF, in vitro fertilization. Mm. So that one can also work. You close out chances. Remember, we are looking for a single sperm like this to fertilize. Mm. So in IVF, that is possible, that you are going to get a single sperm at least to unite with this egg when they're in the same environment, out of the millions that are produced. But when things go really bad, we can pick a sperm and then inject it inside the egg, which we call ICSI, in intracytoplasmic sperm injection. And that is when extremely the person has a low count, has a very poor motility, and the morphology cannot be trusted. Okay, we do not go into abnormalities of sperm structures because that's almost a different presentation altogether. But you'll find that there are many sperms that are structured in a way that they cannot achieve fertilization. So in such a way, you go through the microscope and you pick one whose structure is good. Okay. The other thing I also didn't talk about because of the interruptions we have had is that the sperms that are bad are also causing miscarriages in women at a very high rate. And you will never get to know this. Okay. They have poor penetration, they have DNA fragmentation. Okay. They may have what we call aneuploidy. Okay, whereby you get into the embryo and or the zygote that has been fertilized, and you find that there is either a missing chromosome or is a double chromosome. Okay, and we have what we call trisomy. Okay, you have nucleosomy, you have monosomy, we have trisomy and tetrasomy. So those are all aneuploidal conditions that can cause a sperm not be not work very well. And then we have what we call molar pregnancies. Those can all be sourced from what? From the poor sperms. And then we have what we call
Again, we want to thank you for being patient with us and for keeping yourself here. We really understand that you've been so patient to be connected here. We've had multiple interactions, but we are really trying to make sure we come to finish all whatever we had discussed, we had planned to discuss. Again, like you've seen, men that are following and that are watching in, really we are starting to see that most of the problems that actually our women are having, especially to do with fertility and pregnancy, some of it could be coming from us. But if we don't have such information, we continue to point fingers to them, we continue to blame them for so many things. Did you know that actually some of the causes of miscarriages or abortions actually are coming from the poor quality sperms that we are donating to them? But how many times have you had seen men are choosing or even moving from one woman to another simply because they feel this woman is losing multiple pregnancies? The issue could be that you're donating a poor quality sperm. So uh, before you point fingers, it is good that we understand that you could be the reason your lady is having multiple miscarriages. This is very important and this is very key. And actually, it relates to a lot of people that I know that have had these problems, and when they check, the issue could be coming from the man. So again, to my again to my again to my fellow men, that's why we have this program. That's why I host these programs, to make sure I inform you, I give you first-hand information, to make sure we stop embarrassing ourselves with actually talking or on things that we don't know. Yes, doctor. Okay, so let's listen in, and if you have any question at this point in time, you can actually put your comment in the comment section. And again, thank you so much for being patient with us. Thank you so much. The internet has disturbed us, but I'm quite happy that we've been patient and we've been able to discuss up to this level. Doctor, as we finish this discussion, let's talk about the cost. The cost of handling and management of these fertility issues in Uganda. Are fertility treatment becoming more accessible and affordable in Uganda compared to what it was about 10 years back? Because so many, one of the issues I've always received are people complaining that this process can be very, very expensive. But also for some people who have the money, they say, even getting to right places to have these treatments done is also a challenge. Can we talk about accessibility and affordability?
Accessible, yes. Hello?
Yes, we can hear
Are
you.
you getting me?
Yes.
Hello?
We can hear you.
You can hear me?
Yes.
Yes, access. There have been many facilities that have been opened up currently. Even in our National Referral Hospital, there is a women's hospital. And there are clinics. I think there is one in Imbarara, a number of them in Kampala. The only difference is the success rate, okay, of what you are going to experience. You might want to save $1 here or $1 million here and put it somewhere else, but if you are not going to get the service that you need or the result that you need, it is very hard. You are going to lose to part with the money. Yeah, currently when you go to Mulago, they are ranging between 16 to 15 millions, depending. But at Women's Hospital, right now we have what we call a low-cost IVF, which is going up to December 31st. So which is at 19 millions. But you see, if I ask you to give me 19 millions now, maybe you don't have it. And so is me. But fertility is not an emergency like cardiac arrest or respiratory failure. That if you don't intervene at this moment, the patient is going to die. It's a disease condition, but which can help you to plan yourself. Even if you say that, yes, give me an account, I'll be depositing money as I get it until next year, around the same time, you are free. You can do it. You understand? So it is quite costly because the governments, and it's not just here in Uganda. I worked in Namibia. People take loans from banks. They sell properties to have children. The governments do not prioritize in many low and middle income countries. They don't prioritize fertility treatment as a priority in the healthcare system. So that's why it is still expensive. And the people that are doing the services are almost importing most of the things they use from culture media to machines from other countries. There's nothing that is made locally. Not like maybe you think of ARVs that are now produced in Uganda. Yeah, fertility treatment, hormones, injections used, catheters, they are all imported and they are taxed highly. So that's what keeps their affordability to a high extent. Yeah.
As we finally plan to wrap up this
Mm.
wonderful conversation, Doctor, what can men do in their early
Yes.
life to maintain a healthy fertility?
Mm. Good antioxidant diet of things like fruits and vegetable,
Mm,
regular exercising, okay, of the
mm,
bodies, you know. Yeah,
mm,
exercise. I'm not talking about steam bath. Yeah,
mm,
because someone will say, I'm going
mm.
to exercise in the sauna. No, we talked
Yes.
against that. Yeah,
Mm,
exercise, okay,
mm,
that can help your body to rejuvenate, can help you, okay, and go for a fertility checkup, you know.
mm,
It will not cost you a lot. Instead of trying to think that I think things are okay. I have
mm,
seen men as young as in their 20s who cannot
mm,
produce,
mm.
okay, by visiting a fertility facility to find
Mm.
if you are fertile or not. So those are basic things that men can do. Then
Uh,
for
mm. Again, we want to thank you for staying and uh, yes, doctor. Um, again, how important are factors like mental health, sleep, and stress management in male reproductive health?
mm, yes, stress, of course, by exercising, you get rid of some of the stress.
Mm,
Sleeping is also very important, okay?
mm,
Yeah, for your body hygiene and health, okay?
mm,
So they are really quite important in terms of having a fertile male person. Yes,
mm.
you are very right. Yeah,
Okay.
the stress,
Uh,
of course,
mm,
yeah, sectors from the brain, and it covers the rest of it is extended to the rest of the body. So if your mind is stressed and you are not able to function very well, thinking about the loans, thinking about the pressure at work, thinking about someone taking your property, yes, that will also affect your fertility, right from the sperm count to to the ability to what to erect as a man. Yes.
doctor, can simple life changes
Mm.
like quitting smoking and eating better, stopping alcohol really cause a difference in fertility and the quality of sperms that one produces? Uh, yes, doctor.
Hello?
I'm saying can simple activity like
Yes.
quitting smoking and stopping alcohol really improve one's quality of sperms?
Alcohol. They definitely do, and we talked about some of the risk factors. Yeah,
Mm.
alcohol, smoking, use of drugs, they are very bad uh, for for fertility. Yeah, in men. Mm.
Doctor, someone has sent in a question here saying, what about undescended tests in boys? Can it also cause infertility?
Yes, little bus area.
Yes, please.
Hello?
Yes, and
Yes. As
mm,
we wind up.
Yes.
Yeah.
Undescended tests in men, can it cause fertility?
It can cause infertility. When we're examining men, we even look at the size of your testicles. Sometimes you find there's one missing, and sometimes one is very small compared to the other. Those are all signs that the sperm produced from such kind of testicles can have DNA fragmentation, or you might even fail to produce any sperm at all. Yes.
Okay. These are just questions
Yes.
from your viewers, Doctor. People thanking you for this needed conversation, and they are saying they can't wait to have the second episode of this. Someone here from Wakiso is asking, Doctor, can frequent use of phones and laptop affect the health of one's sperms? Just in one sentence, Doctor.
The laptops can, I don't have good evidence on the phones, but the laptops do. Because of the heat that is generated from the motor of that laptop.
Okay.
Yes.
Then this one is coming from Kauma. Kauma is in Canada and is asking, Doctor, at what age does male fertility begin to decline?
Yeah, fertility, we are talking about a package. And I told you that your levels of erections are not the same when you are a teenager and when you are a
Okay. I want to thank you.
energy to propel them to go into the fertility. So that is where part of the infertility can come from. You have the sperms, but the erection is not there to deposit them.
Okay.
So you start in your early 50s. Yes. The sperms will be there, but the erection is missing. Yeah.
This is funny from Martin in Dubai saying, Doctor, is infertility hereditary among men?
Many conditions can be associated to our genetics. Talk about diabetes, talk about hypertension, talk about cancer. So you have seen families where the man has a series of children, 20 or 30 of them. And you have seen other families from their grandparents having 2, 3 children. And even when they want to have more, they have very few. So those families are also there. Not because of family planning. So that is an area that has not been well researched, but trust me, that it can be inherited. Yeah. We do not talk about another factor called pre-genetic implantation diagnosis, where we take off samples and we can decide to say this child is going to be male and this one is going to be female. People can also have those problems that they are producing a series of girls and a series of boys. Okay. So in that kind of order, we can also think that, yes, hereditary, you can have infertility in the families, that one family does not produce that amount of sperms that is sufficient for production, or that their fertility windows are very short in those families. So that one is also a factor.
Doctor, thank you so much for being here with us. I know it's been a struggle for us to finish this discussion, but it has been very important and impactful. Before you go, what advice would you love to share with couples and men that could be facing this problem of infertility? What is your advice for them?
I encourage people to try and find out what the cause of infertility is. Even if you are not going to afford to treat, at least you will know, yes, it is my problem that my wife is not producing for men. Even women, you will know, instead of blaming your man that, yes, I think it is my fault. Yeah, some of us are born from polygamous families. If I tell you my story of how I was born, it was just a miracle. Yes, because my father had his first wife who could not produce, and then she brought her cousin sister who became my mother. Yeah, so infertility has been there for generations. You can decide as a couple and say, yes, we know we are not going to have a child, but let's adopt one. Okay, instead of spending all the money that you have buying herbs. Yes, I am a Christian, and I believe that it's a Sunday, people are going to church, spending nights in overnights of a miracle that is not going to happen.
Yeah. Wow.
As a couple.
Doctor, thank you so much for being with us today, and thank you so much for your time. We can't wait to
Yes.
host you next week as we discuss
Mm,
infertility on the
mm,
women's side or the ladies' side. And to our viewers, we promise that we are going to make sure we have better connectivity, and
better connectivity, yes.
we shall try to
Mm,
work to see how we can have an interrupted program. Again, I want to thank the management of your hospital for
mm,
allowing you to give us this free knowledge, and also to speak to Ugandans
yes.
and the world at large about a problem that so many people don't want to tackle. From everyone,
Mm,
Doctor, I wish you a very blessed Sunday. And anytime you
yes.
can have within the week, please let me know such that we have a
Mm,
recording on the spams, such where we
okay.
shall talk about the different
Mm,
causes of infertility that actually come from the
mm,
spams. I think so many men
correct.
have questions there. So I'll let you go
Mm,
and wish you a blessed Sunday,
mm.
Doctor.
Thank you very much. I'll do that recording from my workplace where there's good IT system. This was been
Oh,
doing I'm being doing it at home. Yes.
okay,
So I'll
it's
do it
okay.
at home and at work and make sure that it's recorded very well. Thank you very much.
Oh,
And have a nice
thank you.
Sunday
You
and
too.
week.
Okay. Again, I want to thank everyone watching in that has watched in today. Uh, this is where they say, abalemerako be bamalako. We've had so many multiple interruptions, but I want to thank you that you've kept it yourself here. These are kind of discussions that no one wants to talk about. These are kinds of discussions that we don't know. Men listening in today, from what doctor said, we are responsible for more than actually 45% of the issues that are disturbing our women. Things that I've picked out: number one, did you know that your quality of sperms could be the reason your wife is having multiple miscarriages? Did you know that as a man, men, we are responsible for 45% of all infertility cases in couples? Did you know that the women are only responsible for 35% of the causes of infertility? Did you know that 15% of the cause of infertility in couples is both of you have issues, and 15% up to now the doctors don't know the causes? So before we point fingers to our women, let us try to find out. To the couples out there that are battling to have a child, please seek medical advice. Right now, there is a campaign in Mulago to help women that want to have artificial fertilization at a reduced cost. Please go and find out the rightful information. And again, we continue to call upon all people that can afford to set up more facility centers in the country, in different regions of the country, but also to ask the government of Uganda to set up more fertility centers in all regional or government hospitals. Again, my name is Mr. Selfcare. Thank you so much for watching. Remember, the month of November, we are going to talk about fertility, pregnancy, and everything. Today, we started with infertility in men. On Tuesday this week, on Thursday this week, we are going to handle sperms. Men with low sperm count, immature sperms, sperms with no tails, everything to do with sperms. we are going to look at that. We are going to look at its production, its transportation, and how it is able to, the problems that affect it and how we are able to solve them. The next week, we are going to look at women. We are going to look at women infertility on Sunday, still with a representative from Women Hospital of Bukoto. And then the third week, we are going to start the journey of pregnancy, preparing for pregnancy. And here we are going to have Sister Banula from all day from Lubaga Hospital to discuss this topic. And we shall conclude the month by looking at postpartum depression, something that affects almost a big number of women after giving birth. Again, thank you so much for being here. Remember, infertility is not a verdict. It is just a condition that can be understood, treated, and overcome. Let's keep the conversation going. From me and everyone, my name is Mr. Selfcare. Have yourself a blessed day. Bye.